Well, those back to school nerves can hit students as they adjust to new classrooms, teachers, and routines. Parents can help make the transition easier. UW Health pediatrician Dr. Megan Yanni recommends keeping children on a constant sleep schedule, making sure they eat breakfast, and encourage daily physical activity. Some anxiety is normal. Yanni says parents should watch for bigger changes.
If they're having withdrawal from activities that they used to really like, withdrawing from friend groups, if they're having big changes in behavior, huge grade drops or performance changes, that might be a reason to reach out to your pediatrician and see if this is more long-term anxiety or depression or other mental health concerns.